The toe change that exposes hidden high blood sugar is not always a deep ulcer, a black toe, or a dramatic infection. Sometimes it begins with something so small that even in a short medical visit, it can be easy to miss. A little tingling in one toe, a toenail turning thick and yellow, skin cracking between the toes, a blister that should have healed, a toe that feels cold, or a callus that keeps coming back, can look like shoes, age, fungus, dry skin, or poor circulation. But sometimes, these tiny toe changes are the first visible clues that blood sugar has been running too high for too long. This is not normal aging. This is not just ugly toenails. This is not always a shoe problem. Hidden high blood sugar can damage nerves, weaken circulation, feed infection, slow wound healing, and turn a tiny toe problem into a serious foot problem. The CDC warns that diabetes can damage nerves and reduce blood flow in the feet, making wounds more likely to get infected, harder to heal, and in severe cases, increasing the risk of amputation. The American Diabetes Association also emphasizes that diabetes can cause nerve damage and poor circulation, which can lead to serious foot complications. So today, look at your toes differently. Your toes cannot diagnose diabetes by themselves, but they can reveal patterns that deserve an A1C test, fasting glucose, foot nerve exam, circulation check, and a real medical review. The first toe change is tingling, burning, or pins and needles, especially at night. Many older adults describe it as ants crawling, tiny sparks, hot needles, or a strange buzzing inside the toes. It may come and go at first. It may start in the tips of the toes, then slowly spread into the feet. This can happen when high blood sugar injures small nerves, a condition called diabetic peripheral neuropathy. NIDDK explains that peripheral neuropathy can cause burning, tingling, numbness, pain, weakness, and trouble sensing pain or temperature. The reason this is dangerous is that nerve damage often begins quietly. You may still walk normally. You may still feel most things, but the nerves are already becoming irritated and less reliable. If the tingling appears with thirst, frequent urination, blurry vision, fatigue, weight changes, high blood pressure, belly weight, or a family history of diabetes, do not dismiss it as circulation or age. Ask for blood sugar testing. Ask for A1C. Ask whether your toes should be checked with a monofilament, which tests protective sensation. The second toe change is numbness, or losing the ability to feel heat, cold, pressure, or pain. This is even more dangerous than pain because pain warns you. Numbness removes the alarm. A small stone in the shoe, a tight seam in a sock, a blister from new shoes, or a cut from trimming toenails may go unnoticed. The CDC says if you have numbness, you may not notice cuts, blisters, or sores, which can lead to infection and serious foot problems. This is why hidden high blood sugar can be so cruel. It does not only injure the foot, it can hide the injury from you. If one toe feels dead, dull, cottony, or less sensitive than the others, do not ignore it. Compare both feet. Can you feel light touch on every toe? Can you feel temperature normally? Do you step on something and realize it late? Do you develop blisters without knowing when they happened? If yes, this is not just a minor inconvenience. It may be a sign that protective sensation is fading. Once protective sensation fades, the risk of unnoticed injury rises. The third toe change is a small sore, cut, blister, or raw spot that heals slowly. A healthy toe should not need weeks and weeks to recover from a tiny skin injury. Diabetes can slow healing in several ways. High glucose can impair immune cell function. It can reduce circulation. It can damage nerves, so pressure continues on the same spot. It can make infection more likely. A small blister on a toe, especially under a callus, near the nail or between toes, can become a gateway for bacteria. The danger is that many older adults wait too long. They cover it, soak it, put ointment on it, or cut away skin themselves. Meanwhile, infection may move deeper. Diabetic foot infections can become serious, sometimes reaching tendon, bone, or bloodstream. If a toe sore is open, draining, red, warm, swollen, painful, foul-smelling, dark, or not improving, it needs medical care. If you have diabetes, suspected diabetes, poor circulation, or numbness, even a small wound deserves respect. Do not walk on it for weeks. Do not cut calluses yourself. Do not use strong chemicals, corn removers, or home surgery. What looks small on the surface may be deeper underneath. The fourth toe change is thick, yellow, lifted, crumbly, or distorted toenails. Many people laugh this off as ugly nails. But the CDC specifically lists thick yellow toenails as a symptom that should prompt a doctor or foot doctor visit in people with diabetes risk. The American Academy of Dermatology also notes that diabetes can be associated with infections and nail changes, including yellow, lifted, or thick nails. Why would high blood sugar affect nails? Because high glucose can weaken immune defense, feed fungal growth, reduce circulation, and make skin and nail infections harder to clear. A fungal toenail is not always diabetes. It is common, especially with age. But when thick yellow nails appear with recurrent athlete's foot, cracks between toes, slow healing, numbness, or high blood sugar risk, it can be part of a larger pattern. Thick nails also create a mechanical danger. They can press into the skin, cause ingrown nails, create pressure sores, and hide small wounds underneath. If your toenail becomes thick enough to hurt in shoes, if the nail lifts, if skin around it becomes red or swollen, or if drainage appears, see a clinician or podiatrist. Do not dig aggressively under the nail, especially if sensation is reduced. The fifth toe change is peeling, cracking, white soggy skin, or fungus between the toes. This may look like simple athlete's foot, but repeated fungal infection between toes can matter. Moisture gets trapped, skin breaks down, tiny cracks open. In a person with high blood sugar, those cracks can become entry points for infection. The CDC advises checking for fungal infection, such as athlete's foot, between the toes, and the American Academy of Dermatology tells people with diabetes to dry carefully between toes because trapped moisture can lead to infection. Hidden high blood sugar creates the perfect environment: warm skin, impaired immunity, slower healing, and sometimes numbness that prevents early warning. If the skin between your toes is repeatedly cracked, peeling, itchy, white, wet, burning, or smelly, do not only treat the fungus. Ask why it keeps coming back. Are your blood sugars high? Are your shoes too tight? Are your toes crowded? Are you drying well after bathing? Do you have reduced sensation? Do not ignore a crack between toes, because a crack is a doorway. For bacteria, that doorway may be enough. The sixth toe change is a change in color or temperature. One toe may look red, blue, purple, pale, or darker than before. It may feel colder than the others. The skin may look shiny. The toe may swell. The CDC lists changes in color and temperature of the feet as signs that should be checked. Diabetes can damage blood vessels, and high blood sugar often travels with high blood pressure, cholesterol problems, kidney disease, and plaque buildup. Together, these can reduce circulation. Poor circulation means less oxygen, slower healing, and higher infection risk. A cold toe is not always diabetes. It can be peripheral artery disease, Raynaud's phenomenon, nerve issues, cold exposure, or other vascular problems. But after a certain age, a toe that changes color, becomes cold, develops pain at rest, or has a sore that will not heal, deserves urgent attention. If a toe becomes black, blue, very painful, numb, infected, or suddenly cold, do not wait. That can be a circulation emergency. Hidden high blood sugar is not the only possible cause, but it can be one piece of the danger pattern. The seventh toe change is calluses, corns, pressure spots, clawing, hammer toes, or toes changing shape. This is often missed because it looks mechanical. People blame shoes, walking style, bunions, or age. Those can be part of it, but diabetes-related nerve damage can change the small muscles in the foot. When muscles weaken or imbalance develops, toes may curl, pressure shifts, and calluses form on the tips, tops, or bottoms of toes. A callus is not just thick skin, it is a pressure warning. Under a callus, skin can break down. An ulcer can form underneath, hidden from view. If sensation is reduced, you may not feel the damage. This is how a thick callus can become a serious wound. If your toes are curling more, if corns keep returning, if one toe rubs constantly, if shoes suddenly feel tighter, or if you see blood under a callus, do not shave it down yourself. A podiatrist can reduce pressure safely, check sensation, check circulation, and help with footwear. The goal is not just prettier toes, the goal is preventing an ulcer. Now, why are these signs easy to miss? Because each one has a common explanation. Tingling can be blamed on a pinched nerve. Numbness can be blamed on age. Thick nails can be blamed on fungus. Cracks can be blamed on dry skin. A sore can be blamed on shoes. Cold toes can be blamed on winter. Calluses can be blamed on walking. And sometimes those explanations are correct. But when several signs appear together, especially in an older adult with belly weight, high blood pressure, high triglycerides, fatty liver, kidney disease, family history of diabetes, steroid use, frequent thirst, frequent urination, blurry vision, fatigue, or previous prediabetes, hidden high blood sugar must be considered. I have seen a common pattern. A person notices thick toenails, then numb toes, then a small blister that takes too long to heal. Each problem is treated separately. Fungus cream for the nail, new shoes for the blister, a pain cream for burning toes. Months later, an A1C finally shows diabetes that had likely been present for a long time. The toe signs did not diagnose it, but they were clues. The problem was not that one doctor missed everything on purpose. The problem was that the clues looked ordinary when they were separated. Your job is to connect the pattern. If your toes are changing, ask the bigger question: could this be a blood sugar and circulation problem? What should you do today? First, inspect your toes every day, especially if you have diabetes, prediabetes, numbness, or poor circulation. Look at the tips, between the toes, under the toes, around the nails, and the bottoms of the feet. Use a mirror if needed. Second, write down the 7 changes: tingling or burning, numbness, slow healing sores, thick yellow nails, cracks or fungus between toes, color or temperature changes, and calluses or toe shape changes. Third, ask for the right tests. Ask about A1C, fasting glucose, and sometimes an oral glucose tolerance test if results are unclear. Ask for a foot exam, including sensation testing, pulse check, skin check, nail check, and footwear review. Fourth, protect your toes. Wear well-fitting shoes. Avoid walking barefoot. Keep skin moisturized, but do not put lotion between the toes, where moisture can encourage fungus. Dry between toes carefully. Trim nails straight across, or get help if nails are thick, vision is poor, or sensation is reduced. Fifth, do not use sharp blades, acid corn removers, or home surgery on toes. Sixth, seek medical care quickly for open sores, spreading redness, warmth, swelling, pus, fever, black skin, sudden coldness, severe pain, or loss of feeling. The bottom line is this: 7 toe changes can expose hidden high blood sugar, not because toes are magic, but because high blood sugar damages nerves, circulation, skin, immunity, and healing. Tingling, numbness, slow healing sores, thick yellow toenails, cracks between toes, color or temperature changes, and recurring calluses or toe deformities should not be ignored. One sign may be harmless. Several signs together can be a warning pattern. Do not panic and do not self-diagnose. But do not wait until a small toe problem becomes an infection, an ulcer, a hospital visit, or a threat to your independence. If you have noticed changes in your toes, write your age and which sign you have in the comments. Is it tingling, numbness, a thick nail, a slow healing sore, cracks between toes, color change, cold toes, or calluses. Also, write whether you know your latest A1C. Follow this channel for more clear, practical senior health guidance, because catching hidden high blood sugar early can protect your nerves, your feet, your balance, your kidneys, your heart, and your ability to keep walking safely.